Hello everyone. Today we are going to learn about cardiac cycle. Today's my topic is cardiac. So what is cardiac cycle? So a cardiac cycle is nothing but what happens between one heartbeat to another heartbeat. Okay? A cardiac cycle is nothing but what happens between one heartbeat to other heartbeat. How does a heart what all happens in heart during a heartbeat, that is nothing but cardiac cycle. So when we consider cardiac cycle, one cardiac cycle, the duration of one cardiac cycle is 0.8 seconds. Okay, so approximately our heart beats for 72 times per minute. Okay, that is 72 heartbeats per minute, 72 cardiac cycles per minute. So this is a normal heartbeat. Normally our heart beats 72 times, which means 72 cardiac cycles happen per minute. Okay. When we talk about cardiac cycle, we need to understand two things. One is the systole, the other one is diastole. What are these two terms? So let's talk about diastole first. Diastole is nothing but relaxation. It involves relaxation. And the second one, systole, it means contraction. It means contraction. Whenever the terms systole or diastole are used, please do remember diastole means relaxation and systole means contraction. Okay, so this is the basic terminology regarding cardiac cycle. Let's understand the sequential events that happen during a cardiac cycle. So there are three sequences that happen during a cardiac cycle. Three sequences, three events that happen during a particular one cardiac cycle. The first event is joint diastole. In joint diastole, both atrium and ventricle are undergoing relaxation. Okay, both atrium and ventricle are undergoing relaxation, and this happens for about zero point 0.4 seconds. Okay, it happens for 0.4 seconds. Totally in 0.8 seconds, zero point 0.4 seconds in during the half of the time both atria and ventricle are in relaxed state. The next is atrial systole. Atrial systole. It happens for zero point 0.1 seconds. And here in atrial systole, atrium is undergoing contraction. Atrium is undergoing contraction. Atrium is undergoing contraction. Sorry. The next is the ventricular systole. Ventricular, which happens for about 0.3 seconds. 0.3 seconds. And here in ventricular systole, our ventricle is undergoing contraction. So these are the three sequential events that happen during a one cardiac cycle. Okay, so the first event, joint diastole is happening where both atrium and ventricle are undergoing relaxation together, and the second one atrial systole where atrium is contracting, and the third one is ventricular systole where ventricle is undergoing contraction. First one happens for zero point 0.4 second, atrial systole for 0.1 second, and ventricular systole for 0.3 seconds. This is the three sequential events that happen during the cardiac cycle. Okay, let's discuss two things now. Okay, as I told, atrial systole, that is atrial contraction, is happening for 0.1 second. Yes, am I right? Yes, 0.1 second. It is happening for 0.1 second. Does it not mean that atrium is undergoing diastole for the rest of the time? So total atrial diastole, total atrial diastole, which is nothing but the total time atria is relaxing, is 0.8 minus 0.1. Is it not right? So the total atrial diastole is 0.7 seconds. Same goes with ventricle as well. The ventricular systole occurs for 0.3 seconds, and it means that the total ventricular diastole occurs for 0.8 seconds minus 0.3 seconds, which is nothing but 0.5 seconds. So the total time atria is undergoing relaxation or undergoing diastole is 0.47 seconds, and the total ventricular diastole, the total time the ventricle is undergoing relaxation is 0.5 seconds. These are the little bits that is understood. Okay, sometimes it's necessary to read between the lines. These are the points that tell us what the actual meaning is. So after briefly studying about the three events, let's go in detail of what actually happens in these three events. Okay, so let me draw a pie chart here. Let me draw a pie chart here. Let me divide this circle into the events that happen during a cardiac cycle. Since the joint diastole happens for half of the time of this cardiac cycle, I will divide it like this. Joint diastole, it happens for 0.4 seconds. And atrial systole, it happens for 25% of the total 0.8 seconds. So it will be, sorry, 12% of 12.5% of total. So it will be like this. Atrial diastole, 0.1 second. Next, the ventricular systole, it happens for 0.7 seconds, sorry, 0.3 seconds. So this ventricular systole will take this part. So when you represent a cardiac cycle in the form of a pie chart, it will look like this. So let's get back to the actual topic of what actually happens in these three events. So let me start with the first. Okay, joint diastole, sorry, joint diastole. So what happens during this joint diastole? So in this joint diastole, the previous cardiac cycle has just finished, the nerve impulse has just ended, and the fresh impulse is yet to occur. Here in this joint diastole, all chambers are relaxed. All chambers are relaxed here. All chambers are very much relaxed. So when these chambers are relaxed, they will of course easily accept blood. Yes, initially when the joint diastole has started, the whole heart is empty because just now the heart has been pumped out of the heart, the blood has been pumped out of the heart, and the completely it is empty and it is relaxed. So this will allow the blood to enter the heart. It will allow the blood to enter the heart easily. Okay, and here the because of which the filling of the chambers occurs here. All the chambers will receive blood. Okay, and if all the chambers or of the heart are receiving blood, it also means that the AV, atrioventricular valves, are open. Yes, they are open. They are open, which are allowing the blood to flow through the heart. Okay, and here the SL valve is closed. Yes, the SL valve is closed. In this joint diastole, AV valve is open, SL valve is closed. Please remember this fact. Okay, and since the blood is coming into the heart, here 30%, sorry, 70% of the atrial filling happens. Atrial filling happens. In this joint diastole, 70% of the atrial filling happens. Here all chambers are relaxed, they are accepting blood, and AV valves are open, SL valves are closed, and 70% of atrial filling is happening here. Okay, so this is about the first step of cardiac cycle. Next, the next is atrial systole. So what happens in atrial systole? So in atrial systole, the second step is atrial In atrial systole, the SA node during the atrial systole, what happens? SA node initiates the nerve impulse. So SA node is initiating the nerve impulse, and here the atria will undergo depolarization. The atria undergo depolarization. Atria will undergo depolarization. Atria will undergo depolarization is nothing but atria will undergo contraction. Remember here, still AV valve is open and SL valve is closed. Remember this. Okay, so what happens in atrial systole? SA node initiates the nerve impulse and atria undergo depolarization. Because of it, here atria undergo contraction, and AV valve is open, SL valve is closed, and here 30% of ventricular filling occurs here. So 30% of ventricular filling happens here, and this atrial systole occurs for 0.1 second. It occurs for 0.1 second. So this is all about atrial systole. Next is the ventricular systole. The last step is the ventricular systole. So what happens in ventricular systole? During the ventricular systole, as you know, SA node has initiated the heartbeat and it has led to atrial contraction. So when the nerve impulse will reach from SA node to AV node, the ventricle will also receive the nerve impulse and that will lead to its contraction. So the SA node has initiated the heartbeat, it has initiated the nerve impulse, it has undergone depolarization which has led to atrial depolarization, atrial contraction, and when this impulse will reach the AV node, this AV node also undergoes depolarization and it will make sure that this impulse is reached to the ventricles which will lead to ventricular depolarization or ventricular contraction. So this all happens. And one more thing that you need to remember is that when we were studying about atrial contraction, 30% of the filling of ventricle was occurring. And here the filling of the blood into the ventricles is still going on. Blood is increasing in ventricle and this will as the blood is increasing in the ventricle, blood pressure in the pressure increases in the ventricle, and this pressure increase in the ventricle will result in one more thing happening. What is it? The ventricle will completely get filled with blood and this will lead to AV valve closure. This will lead to AV valve closure. Remember, in the three events, during only one event, the AV valve is closing, that is during ventricular systole. During ventricular systole, AV valve closes. And since the ventricle is filled with blood and this blood needs to be transported to lungs and aorta, of course, what should open? SL valves should open. So, SL valves open. So this is what happens during the ventricular systole and all the blood from ventricle is going to go back to the lungs and different parts of the body, and after the blood is transported out of the ventricle, the new cycle will start, new cardiac cycle will start, and joint diastole will start. Okay, so this is what happens during a cardiac cycle. Let me recall once again. There are three events. First one is joint diastole, second one is atrial systole, third one is ventricular systole. During the joint diastole, what happens? It happens for 0.4 seconds, and during this time all the chambers are relaxed because just now the action potential has ended and the heart is completely has completely pumped out its blood, ventricle has pumped out its blood, all the chambers are empty and they are relaxed, they are eager to receive blood. So when they are in relaxed state, they are going to receive blood as much as possible. 30% of filling of atria happens during this phase and AV valves open because of that, and SL valves get closed because of low ventricular pressure. As all the blood is pumped out of the ventricle, the pressure in the ventricle decreases and that will lead to closure of the SL valve. After the SL valve has closed, because of the relaxed state, blood will again start fill into the heart and AV valves are open because of it. And 30% of atrial filling happens during this joint diastole, where both atria and ventricle are relaxed. Okay, and next is atrial systole. During the atrial systole, it happens for 0.1 second, and in this phase, the atria in the atria SA node will initiate a nerve impulse, and this nerve impulse will result in atrial depolarization or atrial contraction. And when the atria will start to contract, and here the 30% of ventricular filling is going to happen here. And valves, when we talk about valves here, AV valve is open and SL valve is closed. Next, let's come to ventricular systole. Here is from the stimulus from the SA node is going to reach the AV node, and it is going to undergo depolarization again, and this nerve impulse is going to reach the ventricle, and it will also undergo contraction. The blood percentage is also increasing in the ventricle, lead to increasing blood pressure in the ventricle. This will lead to AV valves to close, cell valve to open, since blood needs to be transported to the lungs and various parts of the body. So this is all about. The next thing that we need to talk about is heart sounds. Next is heart sounds. So when we talk about heart sounds, a human heart produces two sounds. What are they? They are first lub and dub. Okay, first let's talk about the first heart sound, that is lub. When does this occur? This occurs during the ventricular systole. Lub, the sound lub, the first is called the first heart sound. First heart sound. And it occurs during ventricular systole. And this during this ventricular systole, when the a ventricle is completely filled with blood and the pressure in the ventricle is increasing, that time AV valves close, right? AV valves close. And when these AV valves close, that time this sound is generated. Lub sound is generated. And this lub sound stays for it occurs for 0.15 seconds. Compared to the dub sound, it is longer. And it's not louder than dub, but it is longer than dub. Okay, so this is the first heart sound, lub, that is occurring during ventricular systole. When the AV valves close, that time this sound is generated. Lub sound is generated, and it occurs for 0.15 seconds, and it is longer than dub. The next sound is dub. Next sound is dub. This dub sound, when does this occur? It occurs during joint diastole. It occurs during joint diastole. So when the joint diastole, a new cardiac cycle is starting, and just now the old action potential has ended, and the ventricle has pumped out all of its blood and it is empty now. So that time what happened? Action potential has ended, and the ventricle has pumped out all its blood, that time what will happen? The pressure, ventricular pressure will decrease. This ventricular pressure decreases. When this ventricular pressure decreases, this will force the SL valves, semilunar valves, these semilunar valves to close. So when these semilunar valves close, that time this dub sound is generated. When SL valves during the joint diastole close because of low ventricular pressure, as the ventricle has pumped out all of its blood after the action potential has ended, that time this dub sound is generated. It occurs for zero point 0.1 second and it is louder than lub. It is louder than lub, not longer than lub, but it is louder than lub. So these are the two heart sounds that are generated, and this is all about the sound and how they are generated. I hope it is very clear to you. Okay. The next topic that we need to study is cardiac output. Before cardiac output, we need to study some things, okay? Some basic terminologies, okay? So, when we talk about the cardiac output, we talk about two things, okay? Cardiac output and stroke volume. So how does this stroke volume occur? So when we talk about stroke volume, we need to discuss two things: end systolic volume and end diastolic volume. So when we talk about, we need to talk about this and how this thing works. So the first one is end volume. So what is this end diastolic volume that we need to study? So whatever the blood volume is present during the ventricle, in the ventricle during the diastole, that is nothing but end diastolic volume. The blood in each ventricle, blood in each ventricle during the diastole, ventricular diastole, that is nothing but end diastolic volume, and it is usually 60 ml. It is usually 60 ml. Next is the end systolic volume. What is this end systolic volume? It is nothing but blood in each ventricle during the ventricular systole, is nothing but end systolic volume. Blood in the each ventricle during the ventricular systole is nothing but the end systolic volume, and it is usually 130 ml. Okay, so this is nothing but end diastolic volume and end systolic volume. How are they related to stroke volume and cardiac output? Let me explain now. Okay, so when we talk about stroke volume, what is stroke volume? Stroke volume is nothing but blood pumped out of each ventricle per beat. It is nothing but the stroke volume, SV. How are we going to calculate this? Simple. We already know about end diastolic volume and end systolic volume, right? So it is nothing but end systolic volume minus end diastolic volume. Okay. So we already know that end systolic volume is 130 ml and end diastolic volume is 60 ml, which is nothing but 70 ml. So stroke volume of a normal heart is 70 ml. Okay, stroke volume is nothing but blood pumped out of each ventricle per beat. That is nothing but 70, which is calculated by subtracting EDV, that is end diastolic volume, from end systolic volume. This is all about stroke volume. Now let's come to cardiac output. How do we calculate cardiac output? So what is cardiac output? Cardiac output is nothing but the blood pumped out of heart per beat, per minute. Okay, pumped out of each ventricle. It should be, to be precise, it should be each ventricle per beat. Okay, so how do you calculate it? Cardiac output, CO, can be calculated by stroke volume into the number of seconds. Okay, number of heartbeats per minute. Okay, how number of heartbeats per minute. So stroke volume we already know it is 70 ml into heartbeat is 72 heartbeats per minute. So it is approximately a normal cardiac output of a normal heart is 5 liters per minute. So our heart, on an average, a normal heart is pumping out 5 liters of blood per minute. So this is a normal person. When we talk about an athletes or someone who is exercising, someone who is in sports, a sports person, their cardiac output is usually very much higher. It's 6 to 7% higher than normal average person. Usually they will ask several questions regarding this. There are several questions in NEET that will come on this, just this formula. Can we calculate one question for that as a practice? Let me frame a question here. Let me frame a question here. A normal person, a person is exercising from 30 minutes. His heartbeat, his heart And